Alright, so we're going to start with the bony palpations. Start up here on the sternum with the manubrium, which is the top part of your sternum. And then the middle part that you think of as your sternum is right through here. And then the xiphoid process is at the very end where you want to avoid on CPR. So right there's your xiphoid process. And then commonly called your collarbone, we will call it your clavicle, is this S curved bone here at the front. Then you have your ribs. So your first rib is going to start up here, and then second it's going to be right behind your clavicle, and then you're going to move down the chest. Ribs 1 through 7, we'll just put them right here. Ribs 1 through 7 go down to about here, and those are your true ribs. Then you're going to have a section of false ribs. So your false ribs are the ones that have a common cartilage attachment right through here. And then you have two that are called floating ribs, and they're going to be found back here. And they're your 11th and 12th ribs. Okay, then you obviously have your arm bone, which is your humerus, and then you have some palpations on your humerus. First, you're going to have your greater tuberosity, which is right here. So out here you'll find your greater tuberosity. If you take them into external rotation, you're going to feel a groove as it goes under your thumb. And that's your bicipital groove. Next. And then the next bump you feel is your lesser tuberosity. Okay, so these are attachment points for your rotator cuff muscles. This is a passage point for your biceps tendon. Okay, and then you're going to have parts of your parts of your scapula. The first one you can see his sticking up here, that's your acromion. Okay? And so those two together come and make your AC joint. This is your acromion. And then you have another protrusion off of your scapula called your coracoid process. So you can find that right in the front of the chest. So if you go over his pec and then just in from his shoulder, you'll feel the coracoid process right there. Okay, then if Matt, will you spin around? So we'll talk about other parts of the scapula. You'll see his spine of his scapula right here. So this bony line right here is the spine, and it comes around and finishes into the acromion. So you can see here's his acromion. The spine becomes the acromion. Okay, then we have landmarks on the scapula, one being the superior angle. So you can see his right here. This is the superior angle of your scapula. Then we have an inferior angle, which you can find down here. And then we have borders. So we have a medial border and a lateral border. So your medial border is an attachment point for your rhomboid muscles, and it sits closer to your spine. And then your lateral border would be the edge of it over here.